Hello everyone. Let's discuss about hyperaldosteronism. Hyper means more, aldosteronism the condition in which there is rise or increase in the secretion of aldosterone hormone that is secreted from adrenal cortex. So what is the primary role of aldosteronism? We had discussed in the previous classes, it can cause increase in the level of sodium ion concentration inside the body, reduction in the potassium levels and expansion of extracellular fluid. Okay. So we can say there will be hypersecretion of this aldosterone. There can be occurrence of excessive hypernatremia, hypokalemia and increase in ECF. Now this hyperaldosteronism, it is of two types basically, primary and secondary type of hyperaldosteronism. Let's come to primary hyperaldosteronism first. Another name of primary hyperaldosteronism, it is Cone syndrome. So either you can be directly asked about primary hyperaldosteronism or you can be asked about Cone syndrome. You have to keep this thing in mind. Now, this Cone syndrome, it occurs because of excessive production of aldosterone that may result in decrease in the level of renin. Okay, now from where renin is secreted? You have to think about this also. It is secreted from the juxtaglomerular cells of kidney. Okay. Now, why this fall in the level of renin occurs? This is the physiological mechanism that explains the occurrence of reduced renin secretion. Whenever there is increase in the level of aldosterone, there will be increase in the sodium ion concentration inside the body, or you can say there will be hypernatremia. Increase in sodium ion concentration along with increase in ECF, it will give rise to hypertension that will increase the GFR, and once the GFR will be higher, it will cause reduction in the secretion of renin from the juxtaglomerular cells of kidney. Okay. Now what are the causes of primary hyperaldosteronism? Why does it occur? Because of presence of adrenal adenoma that involves zona glomerulosa. Why zona glomerulosa? Because it is the layer that mainly secretes aldosterone, layer of adrenal cortex. Okay. It may occur in case of adrenal hyperplasia, glucocorticoid remediable hyperaldosteronism, adrenocortical carcinoma, and in some cases because of ectopic aldosterone producing adenoma. Now about the clinical features and the treatment part. The person can suffer from hypertension, headache, poor vision. The patient may also experience tingling sensation in the body, spasm of muscles, muscular cramps, weakness may also be experienced by the patient. Now, coming to the treatment part, how do we treat this clinical condition? Whenever there is adenoma, best thing to do is surgical removal of the tumor. In case of hyperplasia, okay, drugs are effective. We have to treat this condition with drugs such as spironolactone. It is a type of diuretic. Talking about the mechanism of action, it blocks the secretion or effect of aldosterone. It mainly affects aldosterone. It is increased, it has to be decreased. Now about secondary hyperaldosteronism. We had discussed in detail about Cone syndrome or primary hyperaldosteronism. Okay, that occurs because of excessive aldosterone production that results in low renin levels. We had already discussed what is the physiological basis behind this process. Now we shall briefly talk about secondary hyperaldosteronism also. So this type of hyperaldosteronism, it occurs due to increase in the renin activity. Low renin was there in primary hyperaldosteronism. Secondary opposite occurs, increase in renin secretion. Why does it occur? Due to hepatic cirrhosis, cardiac failure, nephrosis, etc. These are the causes. Okay, so renal artery stenosis, it causes stimulation of juxtaglomerular apparatus of kidney and it increases the secretion of renin because renin is secreted from the GJ cells of kidney. Okay, juxtaglomerular cells of kidney. That was about secondary hyperaldosteronism. Okay, thank you very much. In the next class, I will talk about Addison disease.